Good morning. My name is Ivan Sola. I'm a researcher from Cochrane Iberoamerica at the epidemiology unit at the Hospital of Sant Pau in Barcelona. In my work, I used to develop projects of knowledge translation, conducting systematic reviews and guidelines and recommendations. In that sense, we apply a rigorous methodology that allows us to formulate recommendations in an accurate, rigorous, and systematic way. In that sense, the methodology that we use to propose and formulate recommendations in that context can be useful to formulate recommendations in the context of an assessment of appropriateness. In that sense, in the following minutes, I will outline the methodology that we have proposed to do this kind of assessment, appropriateness assessment, for informing clinicians about the value in healthcare. In that unit, the unit of how to assess appropriateness at a local level, as I said before, I will discuss how to assess appropriateness through a rigorous methodology. In that sense, if we need some words about the background that can justify the need of a rigorous methodology to do this kind of assessment, we can say that the need to make decisions in a context of budget and time constraints sometimes does not allow the preparation of comprehensive synthesis of the findings from the clinical evidence to inform decisions. In that sense, rapid reviews have gained popularity as a synthesis format that can be developed in a really limited period of time with following a rigorous methodology, but omitting the most burdensome steps in a systematic review. For example, the double checking of references to decide if they have to be included, or in some occasions, the search in a multitude of databases to find the evidence. So, if we assume and come from a rapid review framework, we also have to ensure that we will be transparent in the way in which we describe the methodology to conduct our review, in the sense that we have to inform the users of this rapid review about the limitations, the eventual limitations of our work. And in that way, the user of this rapid review will have the tools to value if the review has or not major limitations. But the rapid review framework allows us to conduct evidence synthesis that can be useful to inform decisions and can save time. The evaluation of the appropriateness in the clinical practice is a very favorable context for the application of this methodological approach. Depending on the resources and the urgency to respond to the needs of the stakeholders that have to use the evaluations, it is possible to promote the formulation of recommendations based on the findings from the evidence, adopting existing recommendations in specific situations that are explicit with respect to their elaboration. The methodological framework to conduct appropriateness assessment is, therefore, based on a rapid review approach from which can derive judgments on the quality of the evidence and recommendations based on great guidance. This slide here presents the most basic steps needed to carry out an evaluation of appropriateness from a rigorous approach. In the first step, we need to focus the problem. We need to convert the clinical scenario that have raised the idea that is needed to conduct an appropriateness evaluation. We need to translate this scenario to a clinical question. The aim of this step is to define the scope for the clinical procedure that we need to assess. In a second step, we need to go to the clinical evidence. We need to go to the scientific literature to identify the best clinical evidence that can inform and can support our decisions. In a third step, we will synthesize the evidence. We need to develop a clear and structured evidence summary to inform the stakeholders involved in the assessment of appropriateness to allow them to make decisions. And in the last step, the fourth step, we need to formulate the recommendations. We need to formulate the recommendations in an explicit way. We need to collect all the data gathered from the evidence, and we need to make explicit judgments from the assessed evidence to formulate those recommendations that can make a response to our clinical questions. In the following modules, we will discuss further all of these steps, and you will have the opportunity to make specific exercises to put all these concepts in practice. So you have the opportunity to begin with this proposal. Thank you.